Researchers tracked almost 90,000 people for 8 years to see whose memory held up as they got older, and the ones who did best share one simple habit. And it's free, and it takes about 10 minutes, and almost nobody does it on purpose. And that habit is light. Bright light in your eyes early in the day. But almost everyone who swears they're already doing this are getting a fraction of what counts, and it all hangs on that one word: bright, because your eyes and your brain don't agree on what it means. Your kitchen at breakfast may feel plenty bright, but to the clock system in your eye, it's almost nothing. Because deep in your retina, there's a special set of cells that don't help you see at all. They run on a pigment called melanopsin, and their only job is to measure how bright it is and report it back to your master clock, that cluster in your brain called the suprachiasmatic nucleus. If you give it a big hit of morning lightness, it will set your rhythm for the rest of your day. And you need this signal to start the countdown for proper melatonin release later in the day. This is what sets the natural circadian rhythm and determines the quality of deep sleep, where your brain is able to clean itself. So in the study, those 90,000 people wore a light sensor on their wrist for a week, and the ones who got more bright light during the day had a lower risk of dementia. Now, a study like this can't prove that the light itself was the reason. People who go outside a lot may be just generally healthier, and that's what makes them sleep better. But it fits everything we know about the clock, and stepping outside costs you nothing. And every time I talk about morning light, there's a couple of questions that always pop up. The first one is, what do you do if it's overcast or cloudy? Even if there's a lot of clouds or it's gray out, I would still go outside, because an overcast sky still puts out 1,000 lux or more, and the brightest indoor office is only a few hundred lux. So the gloomiest morning outside still beats most of the light inside. And then many people have to get up even before the sun comes out, or if it's during the dark stretch during the winter. This is where it helps to get a 10,000 lux light box and use it for 20 to 30 minutes while you do your normal morning routine, like eating breakfast or drinking coffee or getting ready for work. And you don't need to sit and stare at it. All you have to do is just set it off to the side at an arm's length and angle toward your face, and let the light land on your face while you look ahead, because we don't want to be looking straight at the light. And one quick note, before you start using one, check with your doctor to make sure it's okay in your case. There are a few conditions where you may need a lower lux light, or avoid this altogether. So for people who have bipolar disorder, or any eye or skin or any health condition that can make you sensitive to light. And also there are some medications that can make you more photosensitive. So talk to your doctor to make sure it's safe in your situation. And whatever you use, whether it's outside light or a light box, try to hit it around the same time each morning, because that's what locks in that circadian rhythm.